Hey everyone, welcome back to my channel. This is Dr. Duong. Today I have my patient here, Justin. We're gonna do a little bit of cupping therapy for his elbow. If it ends up being that the inside is a little bit more symptomatic, more irritable, then it's something that usually we call golfer's elbow or medial epicondylitis. And then if it's more on the outside, the lateral side, then it's usually called tennis elbow or lateral epicondylitis. So you'll kind of hear all those terms being thrown around. So Justin, you're a golfer, right?
I try.
You try, okay. So we're gonna check the inside of the elbow first. Any pain here?
A little bit.
When I'm pressing. A lot of our wrist flexors are attached on the inside of the elbow, and they attach up at the humerus here in the upper arm, and then they come all the way down to the hands and to the fingers. We'll take a look at the outside. A lot of the outside muscles are wrist extensors, so they're the ones that bring the hand up like this. And then these can often get really tight too. Anything here?
Yeah,
Tender? More so than the inside?
Yeah.
Okay, yeah, I find that with myself too. So we'll go ahead and just do both sides. That way I can show you guys too how I would usually do cupping therapy for it. We'll start off with putting a little bit of baby oil. We're gonna do a little bit of massage cupping. I might do a little bit of vacuum suction cupping. It will actually work better on your forearm because your forearm is bigger, but when I do cupping for myself, it doesn't really stay on very well for me because my forearm's smaller. Do you ever have wrist pain?
I don't think so.
Okay, nice. So sometimes if these forearm muscles are super tight, you can get wrist pain. That usually happens for me. For a lot of other people, they'll have a lot of pain more towards the elbow. So once we get that all oiled up, I like to start with, I think this one's a small cup. So these are Lear Essentials cupping set on Amazon. I'll link it down below so you guys can take a look at it too. But we'll mainly use these two small ones because this area is a little bit smaller as well. So if we use the bigger ones, they're not gonna suction well. To start off, I always like to warm up the muscle first. So I'll go very light suction, go about 3 rounds along the muscle, and then we'll try to get more perpendicular and then circular. So we'll start up at the elbow here. Very light suction. It usually feels pretty comfortable for patients when you do a lighter suction. That way we can get the muscle warmed up. That's okay.
Mm-hmm.
Wait until we get to the more suction.
No, I feel like this pressure is good enough.
Yeah? Do you feel it?
Yeah, I feel it.
So this is your first time getting cupping done for your forearm, right?
Mm-hmm.
Yeah, if it's the first time, you may not have to go as maximum suction because it's already pretty tight to begin with, versus patients that I've worked on before, they're a little bit looser or they are used to that amount of suction, so then we can go a little bit harder.
But it feels good.
Feels good, right? So we did along the muscle, then we can go perpendicular. Just like that. You can see with this cup, it works along the forearm because it's pretty big up there, but once it gets to the smaller part, it loses its suction. So I would sometimes even transfer over to the small one. Still stay in that light suction, but it's way easier to glide and have more control going a little bit lower. Just like that. Just a little more. If it loses suction, just go ahead, add a little bit more. And then we'll go circles. Sometimes people will feel the circles one a little bit more, but we're also still going light suction, so hopefully not too bad yet. So after warming up the muscle, we'll go ahead and go back to the larger cup. I'll do about moderate suction and see how you feel with that first. And then if you can tolerate more, we'll go ahead and do more, but we don't have to if it's too painful. Okay. If Justin was having just golfer's elbow going on, so pain at the inside of the elbow, then I can just focus on the inside. I'll start on the inside and then glide all the way down. I'll put most of my focus there, but I still want to address the majority of the forearm because a lot of the myofascial tissue is all connected. So if it is myofascial tissue that's really tight that's causing pain, I don't want to just focus on loosening one area. I want to get the whole thing. I always like to check back in to make sure you're doing okay, because even if we can't go moderate maximum suction, we can still get a good bit of relief with the light suction. So I just go where patients can tolerate. We can start to see a little bit of like the red petechia response come up. Usually after the cupping, you'll feel a lot looser.
Okay.
Yeah, almost immediately. That's what I really like about this tool.
I can already feel it being warm.
Yeah, all the blood rushing in, which is great because then all of the new nutrients will come there, help it heal quicker. Right there. Yeah. I can tell by your facial reaction.
If both sides a little closer in around this area, it's more tender.
Where it attaches, yeah. And that's where like most of the muscle bellies are too, which makes sense. So I usually don't do too much with this size cup because the smaller one will get a lot more and can, yeah, I know. It'll feel a little bit more pinchy and it'll be more localized to the muscle. So we can we can find areas where the myofascial tissue is tighter and then it almost kind of sucks in, or it'll get a little bit slower. This area here, do you feel that? Like a different?
Yeah, oh, yeah.
So it's suctioned up into the cup a little bit more, which tells me, I'm like, this area is tight. I'm gonna come back to it. I'm gonna do a couple glides. I like to lift to decompress a little bit more. Sometimes I'll do circles. The slower you move with the cup, the better, because it feels more comfortable for the patient.
So can I go hit balls right after?
Yeah, you can. So usually after cupping, light to moderate exercise is okay. I tell my patients to avoid vigorous exercise just because your body's still technically healing. But yeah, if you have a little bit of movement after cupping, that's good, because then you'll feel less sore. Yeah, especially since it's your first time getting cupping, it might be sore for a day or two.
Yeah.
Totally normal. Keep stretching. You can add a little bit of ice or heat, whichever you respond to the best.
Okay.
I always tell patients too, this is when you're most mobile, so if you can get in some of the stretching, that'll be good. So anytime we get a little bit of the redness, that tells me there's stagnated blood there, and it's all kind of loosening, coming up to the surface, and then the lymphatic system can drain it and excrete it out later for us. Ooh. Sorry? Is it okay?
Yeah, it's okay.
You see how it like doesn't want to move? This tells me I'm like, I'm gonna leave it there. And then I'll go ahead and switch to another one, because then now that's anchored. And then what I can do is I can bring it up, separate it, up, get a little bit more there too. Can leave that one there. So I like to do massage cupping, and then I also can do stationary cupping. So this is where I'll leave it on for 5 to 15 minutes depending on what you need. And I can manipulate the cup a little bit. We can leave it there and have it hang out, or I can lift, I can separate the tissues to stretch it a little bit, which is nice too.